So good morning, my name's Alan, and we're here today for three main purposes. So you know what Reflex Protect is, so you know when to use Reflex Protect, and you know how to use Reflex Protect to keep yourself, your coworkers, and your patients safe in a violent incident. So those are our goals today. And why do we have those goals? Because this is sort of what you have in healthcare, isn't it? You want to foster a safe environment for yourself, your coworkers, your patients, everyone that comes here. You want to empower, and I want to empower you as the caregivers to be able to defend yourself if you have to. Because when seconds count, the police are minutes away. And that's not saying anything negative against the brave men and women that are out there serving us as law enforcement officers. It's just the nature of the fact. If something happens, they're called, it takes them time to get there. In that time before they get there, like you learned in the Run, Lock, Fight class that you attended, you need to be able to do something. And if you cannot escape and you cannot barricade and lock that person out, you have to fight. And we're going to empower you the best way to do that. We want to minimize legal risk. This is a non-lethal option. Not only does it minimize legal risk, it also makes it a little easier up here. Because to shoot somebody with a firearm, that's a big decision that you're going to take someone's life. And there could be some hesitancy. Should I or shouldn't I? With the non-lethal option, if you make a mistake, nobody dies. So you don't have to hesitate as much, because the worst thing that's going to happen is a person's going to be in pain for a couple minutes. Okay? So it minimizes legal risk, but it also minimizes the risk that we have here when we think about having to harm another human being. It strengthens our security responsiveness. Not only can security have this, but we can have the frontline people, the nurses, the receptionists, whoever's in the building that's been trained can have access to this and be their own security and help their coworkers and help patients. We're going to minimize collateral damage as a goal. If I were to take pepper spray in this room and spray somebody, all of us would be coughing and gagging. Even if I used a pepper spray gel, everybody would be smelling it and probably coughing some. So we're going to use a product, Reflex Protect, that does not have the collateral damage. It only affects the person we're going to spray. It's fast and effective, and we have a fast and effective decontaminant, which is very important for you in the healthcare, because it may be a patient that becomes violent that you have to stop, but then you have to take care of that patient. When I teach teachers, I say if it's a bad person comes in trying to harm you or kids, spray them, let them lay there in pain until the police come. You might not have that option. You're in the hospital, you're going to have to take care of them. So we have a decontaminant that we can get that person back healthy quickly. We want to satisfy workplace safety regulations. OSHA has actually said, we need a safe environment, and they have said that an active shooter type situation is foreseeable. And we also know from OSHA that you work in the worst industry for workplace violence. Healthcare is a leading industry for workplace violence across the country. So we want to satisfy those regulations and stuff by giving you means to prevent and respond to that violence. We also want some training. It wouldn't do me much good to throw you a can of Reflex Protect and say, good luck. So that's why we're here today, to make sure you understand what it is, how to use it, and when to use it. And we want all of those goals because we want a safe environment for both the patient's community and you and the staff. We want to be able to be trained better to deal with aggressive behaviors and crisis situations, because the nation shows that you guys are on the forefront of dealing with that kind of problem. Reflex Protect is safe, that it's non-lethal, it is effective, it works faster than pepper spray. I can say that because I've had a number of police officers that have been sprayed with pepper spray, and when they're sprayed in the academy, they have to do tasks. And they get through with the tasks, and then the pepper spray sort of hits in harder, and they're miserable for a long time until they finally are decontaminated and cleaned up. But they get through the tasks. We have yet to have a police officer get sprayed with Reflex Protect and do anything but drop on his knees and say, I'm done. And we've had them say, I'll fight through it. I've done it before. Not this. Don't worry, I'll do it. And they haven't. So it works faster, it is more effective. It's accurate, and it's accurate up to about 15 to 20 feet. So you don't have to be right close to the person. If they're on the other side of the counter or desk, you can defend yourself. And it's very easy to use. And all of you are going to get to use it today. And you'll see how easy it is to use. The Reflex Technology Spray Head. This is one of the advantages to this product. It's intuitive to use. Who here has used a firearm? We're Montanans. A lot of us use firearms. Pretty easy. Pepper spray. You know, bear spray. You got to hold it like this, or you got to hold it like this. It's not as natural as going like this. So the spray here is as accurate as any spray out there. You can only get so accurate when you're doing this kind of spray. But the human factor, if we take it away from the robot spraying it and we put it in a human's hand, it becomes more accurate because we can aim and spray easier this way than we can with these other configurations. So that is one of the keys of the technology of Reflex Protect that has made it a better tool. The Presidia gel, it's not pepper spray. You know, I mentioned here if we sprayed pepper spray, everybody coughing and gagging. It is a CS gel. And it's in a gel, so it shoots out sort of in a stream, sort of like wasp spray. So it'll go 15 to 20 feet. When it hits the face, it just sort of sticks and globs on. And when it gets in the eyes, it burns really bad. CS is the same chemical that's used in tear gas, if you're familiar with tear gas. So that's what the active ingredient that actually makes your eyes and such burn when it hits mucous membranes. It minimizes that cross-contamination. It only affects the person hit. It doesn't atomize and go all over. Even the pepper spray gels, if I sprayed a gel in here, people would smell it and start coughing and stuff. Not as bad as the spray, but it still affects people. And this doesn't. So it works faster. And then the decontaminant gets them back healthier quicker than their experience in the Law Academy. Differences, I'll go through this pretty quick. Pepper spray is made by peppers, so it is a natural ingredient. CS is actually man-made. It's a chemical. And CS is used, it's used a lot in Europe and other countries. It's used in America a lot too for tear gas and riot gas. It just hasn't been used as a defensive personal spray like we're developing now. Okay? It affects sensitive tissue and mucous membranes. OC, skin and respiratory, you will feel a little bit of the CS on your skin too. It mainly affects the mucous membranes and especially the eyes, but you will feel a little heat on the skin as well. Not quite as bad as the OC spray. The O-Spree lasts a long time. It cross-contaminates. If we sprayed it in this room, it would take a long time to clean up this room where other people that come in and not be coughing and gagging. You don't have that with the Presidia gel. If I missed and sprayed some on the wall, we can use that decontaminant, clean up the wall, fine. So you can use this room immediately, not where pepper spray, where you're going to be shutting down the room to get it decontaminated. It's a thick formula designed target specific. Pepper spray, it depends on what you have. Most pepper sprays that you're familiar with, it's a big aerosol. And it just fills the room. They do have some pepper spray gels that are more similar to our product, but you still smell them. Questions on what it is? Everybody understand? Pretty simple. When do you use it then? You need to have a threat. And this is based on law. You need to have an intent, means, and opportunity present before you're allowed to defend yourself. And this would be true with our product, with defending yourself with your hands, with defending yourself with a firearm, or any other self-defense tool. To defend yourself and hurt another person, you need to have these elements present. So intent. The subject matter must demonstrate an intent to inflict physical injury. We can't read their mind, can we? So how do we know? What are some things that you think would be an intent indicator?
Shoving.
Shouting.
Or shoving.
Shoving, okay.
They have a weapon.
They have a weapon. They might say, I'm going to kick your butt, right? So, I mean, any of those things, if I come up here screaming at you and raise my fist, that sort of indicates that maybe I have an intent to harm you, right? So we want to later, in any self-defense situation, be able to articulate why we defended ourselves. And so you need to explain, he had his fist, he was coming at me aggressively, screaming. Okay, I was sure he had the intent to hurt me. The means. Do they have the capability to carry out the threat? Sean Paul, one of our trainers in Missoula, he likes to give an example. He had a patient, he works in a hospital, who was around 100 years old. And if he weighed 90 pounds, that was giving him some. And he was suffering from Alzheimer's or dementia or something. And one day he was going to kill Sean Paul. He vocally said that, but he didn't have the means. Sean Paul's like 6'6", martial artist, former military, former police officer. The older man did not have the means to carry out that threat. So Sean would not have been justified in hurting him, spraying him, shooting him, even though the man said, I will kill you. Okay? So you get intent, but you also have the means. You also have to have the opportunity. So if I called you up on the phone and said, I'm going to kill you, you can't go sit outside my house and wait for me to come out the door to make sure I don't. Okay? We have to have the opportunity. If we had a chain link fence right here, and I'm on this side of a chain link fence, and I have a knife,
that's different.
But I can't get through you to the fence, so I don't have the opportunity. So you wouldn't be justified in shooting me with Reflex Protect or a firearm if I I can't get through the fence. If I had a firearm, and that's not the chain link fence, now I have the opportunity, you would be justified in doing something back to stop me. Everybody sort of understand those three things and why we need to have them? Any questions? Because there's a test coming up. Okay, before we do the test, and I'm serious, we're having the test. We're going to talk a little bit about some factors and circumstances that can help you make that decision. Because it is the totality of everything. Now, I look like I probably have the means to hurt somebody, right? I have the opportunity, I'm in the room. But if I'm going to kill you, I'm going to kill you, that's a little different, right? So even though I'm saying I'm going to kill you, I probably have the means and the opportunity. The totality of the situation, probably not justified. I'm not a threat if I'm trying to run away. Where if I'm saying the exact same thing, I'm going to kill you, and going more aggressive to somebody, it changed the situation. So we definitely want to look at the totality of everything to make sure that we're justified to use that force. Some things that can be threat factors: combative skills and or training. I just told you I've been doing martial arts and stuff since high school in the 80s. So, if you know that person has advanced training in something, their age, the 100-year-old man versus, a 20-something, football player, gender. Men are most often stronger than women, and it can make a difference. Size, physical strength, multiple threats. It's a big difference if you have 2 or 3 people than the one. Okay? The mental state of the threat. If you're dealing with somebody with a mental illness or drugs or something enhanced like that, it can make a difference of the threat. So these can all be factors that you weigh in to your decision making. And you have to be able to do it like that, because situations go so fast. Other factors that can influence, you said earlier, the weapon. So having a weapon or a close proximity to a weapon makes a difference of the nature of the threat. Injury or exhaustion is usually on you. I just told you I've been training in martial arts for a long time. Well, you bust my knee and I can't put any weight on my leg anymore. That just took a lot of that martial art training and stuff and negated it. So if you're super tired or if you're injured, that's going to make a difference. And you may be more justified to defend yourself in those situations than maybe in another situation where you're healthy and everything's good. Disabilities that you have, that's a factor that you want to put in there. You learned run, lock, fight program. Well, if you have a disability that prevents you from running and escaping, it puts you into the lock and the fight automatically. So different things like that. Previous experience. This person becomes violent, and this person maybe has hurt people before. Well, that knowledge is useful in you being able to defend yourself and maybe preempting him from hurting someone else. You don't have to wait till you're hurt or somebody has been physically hurt to stop somebody. Okay? So if they're intending to, you can stop them before someone gets hurt. Special knowledge, anything that you know about the person or about yourself can weigh into your decision making. Terrain or environment. I really like this confined space one. That's important because how many of you are in an office? This is the wall. The door is over there. My desk is here. My door is there, but now I got the person in front of me that's getting violent and I have no way to get out. You're in that confined space. That, makes a difference in being able to defend yourself. I often teach people, if the door is there, I put my desk over here and I make people sit here. They get violent, I can get out my door. Never put yourself in a corner where a visitor could possibly trap you and keep you in if you have an option not to. And I understand some physical layouts are easier to deal with than others, but we try to do our best. And being trapped in a confined space raises the threat, and that's a factor in you defending yourself. Questions on any of those? Do you got one that I didn't talk about that you want to share? Well, the test is coming up. All right, I told you, here's a test. Got a 6-foot, 200-pound male. Walks into the building. He demands to see someone he believes is there. He starts throwing stuff around the waiting room. Spray him or don't spray him?
Call Dr. Silva.
Okay. Okay. Everybody don't spray? Any sprays? Okay, we're not going to spray him. He's not physically trying to hurt anybody yet. That's where you use your de-escalation skills and some of those. You try to calm him down, but he gets angry. You're going to call for help, whoever you said you're going to call. He balls up his fist and starts coming at you. Not going to let you do that phone call.
Well, we're going to spray him.
Who's going to spray him? Anybody not going to spray him? We're going to spray him because he's physically indicating that, and he has the ability and the opportunity to hurt you. You're walking out the front door of the building. A male you haven't seen before heads towards you. He says he's there to see the doctor that messed up his wife. You tell him he needs to leave. He refuses. You pull out your phone to call for help. He grabs your arm and phone, tries to not let you call. Spray him or don't spray him? Who says spray? Who says don't spray? Anybody? All right, we can spray him. He's physically halting your movement, trying to stop you from what you're trying to do. And we don't know how hard he grabbed you, but that would be a spray situation. Patient leaves the building. You watch on the surveillance monitor. She's going to her car, opening her car door. A male approaches her, grabs her arm. They're face to face, and she looks terrified. You go out to help. Spray or don't spray?
No more information. More
Ask questions first.
Okay. Okay. And I'm going to say you can spray on that one.
Okay.
Now, asking questions is not a bad thing. But what I want you to understand is you can go to the defense of someone else. So she was physically grabbed, looked terrified, he looks aggressive. You can spray to help someone else. And that's the point of this slide. So you can help a patient, you can help a coworker. Now, if he was if I would have backed up and said he grabbed you and you're terrified, would you have said spray?
Yes.
Okay. Well, you can spray for her too. And that's the point of that slide. We're allowed to protect others. Your patient resisting, struggling violently because he does not want a procedure done. Maybe he doesn't want blood drawn for whatever it is, something. Spray him or don't spray him? Anybody say spray? Don't? Okay, yeah, it's not a patient management tool, okay? You have to be physically in fear that there's going to be imminent harm to you or someone else. Any questions about when to use the spray? I mean, it's fairly simple. We just want to make sure that people understand that you have to be in imminent danger of being physically hurt, or someone else does. Okay, how to use Reflex Protect. Now, I'm going to show you something important. Blue ones, real. White ones are real. Black ones, training inerts. They got an oily substance, but it's not going to have the burning if you accidentally sprayed somebody with these. So when we go outside, everybody's going to spray black ones at the training targets. Now, if they leak a little bit on your hand, it's going to be oily because there's a soy oil base to make it spray the same as the real gel. Okay? So when we use these, there's two safeties. We have the blue trigger guard safety and we have the safety on top. So that, hold it. I like to put that finger right there on that bottom part and you right in the middle and it pops out. Okay? I'm going to make you do that when you're outside. I recommend when you have it in a docking station, which some of you will see, have it on a wall or it might be under a desk because there's docking stations with these, that you leave this one out. If you're a security person, you're walking around with it in a holster, I would leave this one out. If you buy one of the home ones and you're going to your car, you take it out of your purse, have it out if you think you're in a bad neighborhood. Okay? If it's in a place where it might get jostled, maybe you want to keep this in. If it's at home where you got young kids that could possibly get at it, you don't want to let them have it, but if there's a place they could get at it, maybe you want both safeties. Okay? But once that safety's out, that one pushes up. And it says safe and it says fire up here, so you can know you just push it straight up. Now it's ready to spray. You just put your finger on the trigger and pull. So very, very simple. And we're going to go outside and make you do this under a little stress as well. We're going to be racing and getting yelled at and stuff to do it. Okay? The hardest part is some people have trouble with that because they want to push it like, I'm pushing, but I'm pushing forward, right? It doesn't go. You got to push it straight out the side and it pops out. So you want to push it straight out that way. Pretty simple, right? And we're going to go outside in a few minutes to try that out. But I want to show you about this first. Where do you put it? You can put it on security guards can carry it, nurses' stations, offices, strategically where places that violence may happen. Okay? So you can have that a docking station, you can have it sitting on a desk or something, and Bain will be helping make sure it's strategically put around the hospital. And then it's there for, and the people that are trained know where it's at, and if you ever have to use it, it's there for you. Okay. We're going to go outside and practice in a minute. The Reflex Remove. It comes in a bottle like this, it's clear. This was specifically designed by chemists out of Missoula, some detergent specialists, to neutralize the CS gel. Okay. So, we have a patent pending on it, and it does work fast. Okay. If it's on a surface, you put the stuff on the surface, let it sit a little bit, clean it up. Blot, wipe dry. On a person, here's the important thing. Don't wipe and smear. You want to put this on a towel. You'll see in some of the videos that we used to have a spray one, and we'd spray it in their face and then put the towel. We found it works best, just soak the towel with it, so we don't even have the spray top anymore, and just put the wet towel over the eyes and just blot and then clean up the surfaces where the gel was. Even though they're going to have their eyes closed at first, we're going to put that wet towel, hold it on there, and it's going to start deactivating that. Then we're going to grab another towel, get it wet, and we're going to change towels a couple times and get that person cleaned up. So that's the key. Blot, don't rub. Use it generously as the person needs it. It's going to be a couple minutes, and I mean 2 to 3. I mean, the guy I did the most recently in Kootenai Health, 3 minutes after I started filming it, because I had one of his people shoot him, and then Ben was helping him with the reflex remove, and I was filming it with my phone. He was like, yeah, I'm okay now. And I said, no, it's been 3 minutes since the start. So that's how fast we can get somebody back healthy. And he went down and was like, yeah, you got to stop this. And then we got him healthy. And after that 3 minutes, he kept doing it. He goes, I don't need to, but it feels better. So he kept doing it for a few more minutes. So that's the key on the reflex remove. Liberal and just blotting, not rubbing. I will give you guys a treat. This is a live spraying.
I'm a retired law enforcement officer out of Missoula, former military experience, SWAT experience, defensive tactics, use of force. And we're going to talk about that use of force. I have 2 goals for you when you leave here. 1, I feel comfortable with when to use this product. 2, and this is why it's critical for us to go outside and practice this, is I feel comfortable with how to use the product. And Rex is right. This is that fight scenario of run, lock, fight. We don't expect you all to be martial artists and know how to physically engage a violent encounter. And keep in mind, we're talking about armed intruders. This is not classroom management. And we'll talk about that balance. So this is what we're talking about. It's Reflex Protect. This is a defensive chemical spray that is designed to be used. Stop, get back, stop, get back, stop, get back, stop, get back. Get down, get down, get down. So this is a live product demonstration. This is the product. He's been pepper sprayed. He's had other sprays done to him, so he knows what to expect. But this is a CS gel. We're now using something we will talk about called the decontaminant product. Something that is critical is how now do we take care of that person. Of course, if they're still being violent, still being aggressive, that's law enforcement. But maybe that's somebody who stood behind the assailant and got sprayed. Maybe that's your desk. Maybe that's your floor, your chair. I needed that in healthcare. How do I clean the physical environment? How do I clean the person?
That was a law enforcement officer who had been pepper sprayed, tased, and he told us, I'll fight through it. He told Sean, the guy that sprayed him, I have a high pain threshold, and I'll fight through it. I've done this before. And when he dropped, and later we got a testimonial. He talks later to the group saying, all I could think of was I wanted stuff to stop when I dropped to my knees. And I remembered you guys said you were going to take care of me, and I was just hoping that But that's how quickly it has dropped people. And I said, and that was a law enforcement officer that was sure that he would fight through it, just like he had fought through other things. Let's go outside. All right, who wants to go first? I'll go first. All right. All right. So let's have 3. We'll start with just 2 people. Let's just have 2 people. Stand at the back of the sidewalk, and here's your target. So I want you to pop out your one trigger safety. There you go. Pop up the other one, and spray. There you go. Pretty simple, right? Yeah. Well, it's sort of like it's playing a puzzle, so it just fits.
It just fits in real nice.
Yep, it fits in one way. There you go.
Oh, no. Okay.
Not yet. I want you to set that on the ground. You set yours on the ground. You guys turn around. Now, this is a race to see who can hit that bullseye faster. So, it's because that bullseye's a bad guy, right? Don't be cheating. You gotta look that way. Go now, go! Hurry up, go! Go! Come on, go! Get him, go! Oh, good job. All right. That's what it was supposed to do. So, if other people can watch where these fly, and we can grab them. There you go.
Gosh, that was spooky.
I'm like, you're invading my personal space.
All right, next 2 people. Yeah, whoever picks my group always gets the loudest, because I've been doing this a long time and I'm loud. So I want you to do out the tray, take out the safe, there you go. Push up the other one, and go ahead and spray. Right in front. Pretty simple, right?
Yeah.
There you go. And then put it on the ground. Turn around. Ask her over there how scary it was. Can you tell her how scary it was? Go now, go back, go, hurry up, go. Hurry, get him, go, get him, go. There you go, all right. See why we want to practice a little bit with them. And that's why, you know, because you want to be able to get that, because in a real situation, it's going to be a lot scarier than me. And that's why in a real situation, I said I would leave that one off when you have it in your docking stations. But for today, I want you to practice with both. But I would not use that one when I had it in the docking station.
Right.
I'd just pull it and go.
Oh yeah.
Yep.
Definitely.